Government to comply with the Joint Committee's agreed decisions. What they do provide is, as he outlined, that safety net, as it means that any harmful defaults which are even inadvertently activated and could jeopardise the peace process or create confusion are avoided by giving certainty about the fact that we will deliver, as we said we would, on unfettered access and issues that protect Northern Ireland's place in the United Kingdom.
With the UK at the foothills of a new era and a raft of trade negotiations ahead of us to negotiate, which will affect the lives of people in Putney and across the country, what message does the Secretary of State think that it says about our word that the UK is prepared to break international law at times, to override treaties, to rewrite commitments that we signed up to only months ago?
Well, obviously, I'm sure the Honourable Lady will appreciate, as I said earlier on, that there are some precedents in very specific technical circumstances. Countries around the world, including some of those we will be looking to and are working to secure trade deals to vary their position on international laws. I've outlined that we will be doing in this situation. But I would say to her that as our trade negotiations are starting and are ongoing, I think countries around the world will be looking at the UK as a country that is outward looking, that is global, that believes in free trade and wants to deliver that for the benefit of economies around the world and, as I say, for the United Kingdom. And I want to make sure that Northern Ireland benefits from that, and the clauses we will put in the bill tomorrow will ensure that regardless of anything else, that Northern Ireland will benefit from those kind of trade deals.
Thank you, Mr. Speaker. I thank the Secretary of State for his earlier answers to my colleagues and the reassurance that's given me and my constituents in Newcastle underlined that in the negotiations, although we all want to deal, we will not compromise on the things that make our state independent. But on Northern Ireland, does he agree that we need flexible and imaginative solutions? Those aren't my words, they're the words from the EU negotiation guidelines.
My honourable friend makes a very good point, and I think those kind of flexible outcomes are exactly what we need. I am sure, as I say, that the negotiators, both on the EU side as well as I know on our side, are determined to make sure we deliver on that, because that's how we get the right outcome for people across the United Kingdom. And as I say, importantly, it means that we can continue to deliver for the economy of Northern Ireland as well as to continue to protect the peace process.
Rachel Hopkins.
Thank you, Mr. Speaker. The purpose of the protocol is to protect the Good Friday Agreement. Can the Secretary of State outline what discussions he's had with parties in the Northern Ireland Assembly and with the Irish Government around the new clauses in the Internal Market Bill?
Obviously, I'm having conversations with party leaders, party members and indeed the Irish Government all through, but the clauses in the bill obviously won't be published until tomorrow. We will be having ongoing conversations with partners and colleagues around that. But I would just say to the Honourable Lady, actually, in order to ensure that we can continue to deliver on the Good Friday Agreement, it is important that we ensure there are no borders, north-south or east-west. That is all part of ensuring that we deliver on the Good Friday Agreement. We are determined to do that. We will do that. The clauses that will be in the UK Internal Market Bill are important in ensuring that even if we do not come to an agreement on the Free Trade Agreement, even if the Joint Committee doesn't come to positive conclusions in how we manage the protocol, that we, the UK Government, are able to show that we are delivering on that and there will be no borders.
Technical note on the implementation of the Northern Ireland Protocol earlier this year, the European Union suggested that its rules, quotas and tariffs might be imposed on fish landed from Northern Ireland vessels into Northern Ireland that was destined for Great Britain. That runs contrary to the command paper of earlier this year, certainly, but does my right honourable friend agree with me that it drives a coach and horses also through the Northern Ireland Protocol itself?
My honourable friend makes a really important point, and this is one of the key areas that the Joint Committee is continuing to work on, and it's important they come to a satisfactory, sensible and positive conclusion for both parties to ensure that we can deliver on the protocol in a way that we can all agree on in a positive way. That's the perfect outcome. That's what we're focused on, and that's what we want to see achieved.
Thank you. The Secretary of State will know that the North East has traditionally sent proportionally more of its young people into the armed forces than any other region. As a consequence, we have many veterans who served during the Troubles. They, their loved ones, and indeed all of us are proud of the hard-won peace. At the heart of the protocol is protecting the Good Friday Agreement. Is he seriously contemplating using it as a bargaining chip in a trade deal?
I would just say to Honourable Lady, if she looks through my answers throughout this afternoon, I think I've been absolutely clear. It's quite the opposite. We are determined to ensure that we have a structure and a situation for the United Kingdom and the people of Northern Ireland that continues to deliver on the Good Friday Agreement. We're determined to ensure we do that. That is a piece that has been hard won, and it must be protected and delivered in the future as well.
Thank you, Mr. Speaker. My right honourable friend, the member for Skipton and Ripon, worked tirelessly to get the Northern Ireland Assembly back up and running, something which people said couldn't be done. My right honourable friend, the Minister, has taken out key members of the new IRA because of his commitment to peace and the hard work he's doing. He's also a very successful businessman who understands that business needs certainty and what carries forward. Does my right honourable friend agree with me that it's hubris in the extreme to doubt this government's commitment to the governance of Northern Ireland, the protection of Northern Ireland and the peace in Northern Ireland?
Yeah. My honourable friend makes a very generous point about a number of my predecessors who all worked hard on this, actually across this House, to be fair, as well, in terms of the gains from the peace process. And I will say he's absolutely right around the fact that one of the things that have been consistently coming forward from Northern Ireland businesses across all sectors is the desire for certainty and understanding of what the situation will be for them in terms of trade, as honourable members from the Democratic Unionist Party have outlined as well today, should we get to January and that free trade agreement has not been agreed. We outlined in the command paper and the guidance notes, which was positively received. The work we do in the UK Internal Market Bill will go further to ensure that they have confidence of what the situation will be, even if we're not able to succeed in a positive outcome to those agreements and the discussions of the Joint Committee.
Thank you, Mr. Speaker. Would the Secretary of State agree with me that what was used as a negotiating ploy over the first few years was this concept of a hard border on the island of Ireland, when most people should know, if they're in the real world, that it is inadvisable, unworkable and undoable? No one wants it to happen, no one's going to construct it, and would he ensure that his colleagues know that we mustn't allow something that's not going to happen to impede the need to get something that must, a good deal?
The honourable gentleman makes a very powerful point, and he's absolutely right. Nobody wants to see, and there is no reason for there to be a border either on the island of Ireland or between the island of Ireland, Northern Ireland and Great Britain. We're determined to deliver on that, and as I say, the clauses that will be in the UK Internal Market Bill tomorrow are there as a safety net to ensure that, even if we do not come to a satisfactory conclusion to the free trade agreements. But that's something I'm sure both parties acting in good faith will be able to do in the weeks and the next few months.
Butler. Thank you, Mr. Speaker. May I ask a very simple question in case anybody is still unclear? Does my right honourable friend agree that it is of paramount importance to protect the peace process and that to do so, unfettered access is essential between Great Britain and Northern Ireland?
In the spirit in which the question was asked, yes.
Jonathan Edwards.
Diolch yn fawr iawn, Mr. Speaker. Listening to the debate today, would I be right in summarising that the oven-ready deal we were promised by the Conservative Party at the general election is missing a cooking apparatus?
Well, I would say that the apparatus that we're using is working through the Joint Committee and the Free Trade Agreement deals and the UK Internal Market Bill. As anything, this is all part of a package of things that mean that we're able to ensure that when we finish the transition period at the end of December this year, companies, businesses and people of Northern Ireland have confidence about what the situation will be in January, even if we're not able to conclude those negotiations satisfactorily.
We're now heading to Bob Blackman, who's about to land this question. Bob Blackman.
Thank you, Mr. Speaker, and I welcome the statements made by my right honourable friend. And clearly we hope that there will be a comprehensive free trade deal with our friends from the European Union negotiated in good faith. But does he agree with me that it will be wholly irresponsible of the government not to take measures to ensure the integrity of the United Kingdom and preserve the ability of Northern Ireland businesses to trade with the rest of the United Kingdom by publishing this draft bill tomorrow, and that the government will ensure that we preserve that integrity whilst always preserving the sanctity of the Good Friday Agreement?
My honourable friend has put the situation absolutely perfectly. The bill, as we will publish it tomorrow, colleagues across the House, members across this House will see, will set out how we ensure the integrity of the United Kingdom trading markets, that customs union, the single market that's been so much a part of the United Kingdom for so many hundreds of years in reality, and will ensure that we are delivering on our determination to ensure we continue to see the benefits in the peace process, that we deliver on the Good Friday Agreement, and we deliver on our promises to ensure that there are no borders, that we have unfettered access to Northern Ireland businesses, and we deliver on exactly what we said in our command paper and in our manifesto.
In order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating in the next, I am suspending the House for 3 minutes. Order!
Order. Order. I call Secretary of State Matt Hancock to make a statement.
Thank you very much, Mr. Deputy Speaker. And with permission, I'd like to make a statement on coronavirus. As a country, we've made huge strides in our fight against this invisible killer. Today's ONS figures show that the weekly coronavirus deaths have dropped to the lowest number since mid-March, and the latest daily number of recorded deaths is 3. However, Mr. Deputy Speaker, we have seen a concerning rise in the number of positive cases, particularly amongst younger people. And these figures serve as a salutary reminder that this virus is still very much with us and remains a threat. So it is critical that we maintain our collective commitment to controlling this disease. And social distancing is the first line of defence. While young people are less likely to die from this disease, be in no doubt that they are still at risk. The long-term effects can be terrible, and of course, they can infect others. 6 months on, many people are still suffering chronic fatigue, muscle pain, and breathing difficulties. previously fit and healthy people reduced to barely being able to function. A King's College survey published today shows that 300,000 people in the UK have reported symptoms lasting for more than a month, and 60,000 people have been ill for more than 3 months. And Mr. Deputy Speaker, I want to address the point, which is of course good news, that the number of people sadly dying from coronavirus in this country is currently low. We've seen all across the world how a rise in cases, initially among younger people, then spreads, leading to hospitalisations and fatalities. In Spain, where the rise in cases started around 2 months ago, hospitalisations have risen 15 times since mid-July. The number of daily deaths there has reached 184. In France, hospitalisations have more than tripled in the same period. So this must be a moment of clarity for us all. This is not over. Just because we've come through one peak, it doesn't mean we can't see another one coming towards our shores. But together we can tackle it. So long as we remember that in a pandemic, our actions today have consequences tomorrow for the people we love, for our communities, and for our country. Mr. Speaker, each and every citizen has a responsibility to follow social distancing and help stop a second peak. And after social distancing, the next line of defence is test and trace. Over the past 6 months, we've built the biggest testing system of any major European country and one of the biggest testing systems in the world. And today, I can tell the House that we've met our target to provide testing kits to all care homes for older people and people with dementia that have registered to get tests. But I will not rest. We're working flat out to expand our testing capacity even further. Using existing technology, we're expanding our capacity right now, and we're investing in new testing technology too. Last week, I was able to announce £500 million for next-generation tests like saliva tests and rapid turnaround tests that can deliver results in just 20 minutes. The ability to get rapid, on-the-spot results will significantly increase the weapons in our armoury in our fight both against coronavirus and for economic recovery. We're rolling out these tests right now and plan to use them to relieve capacity constraints, to expand asymptomatic testing, to find the virus, and to give people the confidence that a negative test result brings. Mr. Deputy Speaker, where it's necessary, we will not shy away from taking targeted local action. In June, I established the Joint Biosecurity Centre to provide the best possible data analytics using information from all possible sources. Our local action is driven by the data. We now publish daily local data on cases so that everyone can see the data on which these decisions are taken. And this shows that our approach is working. For instance, in both Leicester and Luton, the weekly case rate has more than halved during August. I want to thank the people of Leicester, including the honourable gentleman opposite, and of Luton, and the other areas where we've taken local action. I want to thank the people who followed social distancing and helped to bring the virus under control. Sometimes local action requires us to act fast and respond to changing circumstances. And unfortunately, after improving for several weeks, we've seen a very significant rise in cases in Bolton. Bolton is now up to 120 cases per 100,000 population, the highest case rate in the country, and I'm publishing the data behind the decisions that we've taken. I must therefore tell the House that, working with the local council, we're taking further local action. The rise in cases in Bolton is partly due to socialising by people in their 20s and 30s. We know this from contact tracing. And through our contact tracing system, we've identified a number of pubs at which the virus has spread significantly. We're therefore taking the following action in Bolton, starting immediately. We will restrict all hospitality to takeaways only, and we'll introduce a late-night restriction of operating hours, which will mean all venues will be required to close from 10 p.m. to 5 a.m. We'll introduce urgently further measures that put the current guidance that people cannot socialise outside their household into law. I want us to learn the lesson from Spain and America and France, not have to learn the lesson all over again ourselves through more hospitalisations and more deaths, and take this action locally in Bolton. But crucially, we all have a part to play. Young people don't just spread the virus to each other, they spread the virus to their parents and their grandparents. They spread it to those they come in contact with, and to others who they love. Now, I know social distancing can be hard, and how it'll be extra tough for students who will be starting university. But please, stick with it and play your part in getting this virus under control. Mr. Deputy Speaker, we're also putting in place extra measures, including visitor restrictions, to restrict the spread of virus into care homes and hospitals in Bolton. And I want to thank the leadership of Bolton Council, who are doing an outstanding job in very difficult circumstances. And I want to thank colleagues who represent Bolton in this House with whom I've discussed these measures. And I want to say this directly to everybody living in Bolton. I know how anxious this can be, and I know the impact that these measures will have. We're asking you to take a step back at a time when we all just want to get on with our lives and what we love and back to normal. But we need to take this crucial step to keep the virus at bay. Because as we've seen elsewhere, if we act early and control the virus, then we can save lives. Mr. Deputy Speaker, as well as controlling the virus using the tools we have now, we'll also do everything in our power to bring to bear the technologies of the future. Over the past few months, we've seen the pivotal role that technology has played in our response, like next-generation rapid testing and machine learning tools to help the NHS predict where vital resources might be needed, and the discovery here in the UK of the only 2 treatments known to save lives from coronavirus. We want to keep this momentum going, and so today we're also allocating £50 million from our AI in Health and Care Award, and this fund aims to speed up the testing and evaluation of some of the most promising technologies. Because through bringing new technologies to the front line, we can transform how we deliver critical care and services across the country. Finally, Mr. Deputy Speaker, the best way out of this coronavirus pandemic remains a vaccine. We've already announced that we'll roll out the most comprehensive flu vaccination programme in history this winter. We now have agreements with 6 separate vaccine developers for early access to 340 million doses of coronavirus vaccines, and we will use every method at our disposal to get as many people protected as possible. Mr. Deputy Speaker, this virus feeds on complacency, and although time has passed since the peak we saw in the spring, the threat posed by the virus has not gone away. So now, with winter on the horizon, we must all redouble our efforts so we can get this virus on the back foot. And I commend this statement to the House.
Jonathan Ashworth. Thank you, Mr. Deputy Speaker, and I thank the Secretary of State for advance sight of his statement. There can be no question that the rise we have seen in recent days in case numbers is deeply worrying. I agree with the Secretary of State this is no time for complacency, that those who suggested this could be over by Christmas were foolish, and that we should be doing everything we can, taking every reasonable measure possible to utterly suppress this virus. It is indeed a very dangerous virus, and I am pleased that he and his department have recognised the condition of long COVID. We probably need a better term for it, but I've recognised that many people get long-term conditions as a result of this virus, and I'm pleased about the emerging research into that. The trends we have seen in young people catching the virus are something that we've seen for some time in Greater Manchester, and indeed when Leicester went into lockdown it was because we were seeing trends amongst young people, and many have warned that we could be facing a resurgence as we move into winter. Specifically on Bolton, can he confirm that he has just announced that in announcing the pub closures and other hospitality sectors across Bolton, whether that has been discussed and agreed with the Mayor of Greater Manchester? And can I ask him a very practical question? He may not realise, but I actually grew up in Radcliffe, which is next to Bolton. What happens if people in Bolton want to go for a drink and end up going to Radcliffe or Bury or indeed Chorley, which will be of interest to Mr Speaker, will they be allowed to travel to neighbouring areas for a drink or not? How will it be enforced? And given the action he has taken on the hospitality sector in Bolton, is he keeping the hospitality sector under review in other hotspot areas? And what guidance has he issued to pubs and restaurants, etc., in those areas? I'm grateful what he said about Leicester, and we have made great progress in the city of Leicester, but we still have the rule in place where people cannot congregate in their private gardens with their extended family. Can I ask him again, can he set out the evidence as to why people cannot congregate in gardens, and can he update us as to when Leicester will be reviewed next, because the infection rates have come down? Universities are set to return imminently, yet the SAGE analysis was not published until last Friday. Will he urgently provide a national plan for reducing transmission of the virus in the higher education sector? And on schools, we've seen a number of outbreaks in recent days, indeed including the school that the Prime Minister visited in Colville a few weeks ago to promote the opening up of schools. But the exact circumstances in which a school ought to close if a pupil displays symptoms is still unclear. So in what circumstances does the Health Secretary believe a school should close? Now, he may recall I warned him early on that one of the biggest barriers in this outbreak, one of the biggest barriers to self-quarantine would not be fatigue, but personal finances. Will he accept that the government needs to go much further in helping people who need financial or housing support to isolate? Otherwise, he will never get on top of infections in areas that are characterised by low-pay, child poverty and overcrowded housing. And does this not help explain the poor record of contact tracing in these areas? In Bolton, only 57% of non-complex cases reached. In Oldham, only 50% of non-complex cases reached. Blackburn, only 47%. Bradford, only 43%. And nationally, only 69.4% of contacts are now reached and asked to self-isolate. These are the latest statistics. And these are the latest statistics, his own statistics that he publishes. What is world-beating about that? And on testing, there was little explanation in his statement just now as to what has gone wrong with testing in recent days. He says, or he tells us, we're supposed to have capacity for around 300,000 tests a day. Around 100,000 of that is supposed to be antibody tests. What is the current capacity for testing at the moment? How many PCR tests are available at the moment? Yesterday, the Secretary of State said no one should have to travel further than 75 miles for a test. But for many people, such as the 20% of home care workers on 0 hours contracts, taking a 150-mile round trip for a test simply isn't feasible. And indeed, at the moment, it's not even possible. Last night it was reported there were no tests in London. People in Kent were asked to travel to Cardiff. In Denton, they were advised to visit Llandudno. In Leicester, someone was advised to head north to Edinburgh. But in Devon, helpfully, people were told they only need travel 20 miles. But unfortunately, that involved crossing the sea to get to Swansea. Now, I know the Secretary of State thinks he walks on water, but many of our constituents can't. Now, at the Health Select Committee earlier, he admitted it will take weeks to fix these problems. Yet last week, he was boasting of plans for 10 million tests a day as part of his Operation Moonshot. But when he can't even get the basics right, never mind moonshot, people will think he's on another planet, Mr Deputy Speaker. His testing regime has been a fiasco in recent days, and yet we had no apology from him today. And isn't the core of the problem this? He didn't listen to the experts. They all advised him to invest in public health teams and NHS labs. Instead, he gave contracts to outsourcing firms like Deloitte, Serco and G4S, who had no experience in testing and tracing. Surely he should now accept that was a mistake and invest in public health teams instead. Mr Deputy Speaker, we must do everything reasonable to suppress this virus. But instead, in recent weeks, we've had muddled messages, failed testing, ineffective contact tracing. Winter is coming. The Secretary of State needs to get a grip.
Well, Mr Deputy Speaker, I'll certainly answer the questions that the honourable gentleman poses, but I'll just start with this. The proposal from the gentleman opposite to dismantle the testing system that we've built so painstakingly over the last 6 months, yes, using the NHS and using PHE, but also using all of the testing capacity of the nation, that is one that I and the British people will reject, because we need to build our capacity, we need to build what we can do. We have built it. We've built one of the biggest testing capacities in the world over the past 6 months, and I will reject all calls for narrow partisan reasons to dismantle a testing capacity that is working. Now, of course, with the increase in demand for tests that we've seen in the past few days, there have been challenges which we have acknowledged. When we are working day and night to fix those, and the long-term solution using the new technologies that is coming on stream is a critical part of making sure that we can expand testing capacity still further. He also, Mr. Deputy Speaker, I'm afraid, got into a bit of a muddle on contact tracing, saying that under 70% of contacts are traced. That is, I'm afraid, simply untrue and below the number that we published weekly. We published the latest last Thursday. He asked rightly about, some of the questions were very sensible. He asked about schools. He's quite right that having clear guidance on how we approach schools and having clear guidance on what schools should do in the event of an outbreak in a school is important. That guidance has been sent to schools and published, and in the first instance, of course, a school should work with their local director of public health to minimise the impact of an outbreak. He also asked about financial support for those who have to self-isolate. We've put that in place and we've rolled that out in areas of the northwest, and we're watching the progress of that effectively. He asked rightly about Leicester, and I understand, of course, he has both a national responsibilities and a local interest in Leicester. Leicester has gone, the local lockdown in Leicester has resulted in a very significant drop in the number of cases, and we take a formal review of the measures in Leicester on Thursday, and I will be certain to talk to him in advance of that and take his local intelligence and views into account. He asked also for a plan for higher education. There's been an enormous amount of work with all of the universities to ensure that we can have a safe opening of the university sector in the coming weeks. And finally, on Bolton, I'm glad that he started his response in a constructive form about the measures that we have to take in Bolton. I have communicated with the Mayor of Greater Manchester, and he's had a briefing from the official team that's been offered. The statutory responsibility, of course, is with Bolton Council, with whom we've been working very closely to put these measures into place, and the measures have been essentially build on the measures that Bolton Council have been putting in place. And I just want to put on the record my thanks to those in Bolton Council, the leader, David Greenall, who's been doing an excellent job, the Director of Public Health, and the Chief Executive, because it's been a difficult challenge in Bolton. Thankfully, what we've learned from this sort of local action elsewhere in the country is that we don't see large-scale numbers of people travelling nearby other areas where there's a problem. We haven't seen that yet. Of course, we remain vigilant on that and all of these measures, but I'm sure that the people of Bolton will understand how significant this problem is, and will follow the guidance and indeed the new laws that we will bring in to back up the proposals that we've made today.
Jeremy Hunt.
Thank you, Mr. Deputy Speaker. And can I thank the Health Secretary for his public recognition of the terrible symptoms that many people face many months after their coronavirus bout has ended. His words will give great comfort to the 60,000 people who have been suffering for more than 3 months. On testing, I think it is very important to recognise the step change that we have seen and the massive increase in the volume of testing that is now taking place. So could he give the House some sense of the confidence that he has that with this increased testing, with local lockdowns that are now being rightly pursued, we will be able to follow the low infection levels in South Korea, Taiwan, Singapore and Hong Kong, and not see those increases that we've seen in France and Spain, and see ourselves getting back into another national lockdown.
Mr. Deputy Speaker, the chairman of the Select Committee it precisely sets out our goal. In some countries, not only in the Far East, but also closer to home, they have seen a rise in cases, especially amongst younger people, taken action, and that has turned the curve. That's particularly true, for instance, in Belgium, which we were very worried about a month ago, but the case rate has come right down when they put a curfew in place. We are taking action, local action here. Our approach to local action has been commended by the World Health Organization. But of course, the responsibility is on all of us. And I know that this is a riff that we talked about a lot in March and April and May as the cases were coming right down. But we all have a role to play in this, because the local action and the test and trace actions that we take in government and with local authorities are only the second and third line of defence. The first line of defence for everybody in this chamber and all of our constituents is to follow the social distancing. So we'll be stepping up the communications, making sure that people are reminded very clearly with clarity of the rules. We'll be taking action to step up enforcement too, to make sure that we can keep this virus under control until we can build up both the mass testing capacity and, as I mentioned in my statement, ultimately the vaccine, on which the scientists are doing great work, but all vaccine work is uncertain until we get clarity from the regulators that it is safe and effective to use.
Video link, Dr. Philippa Whitford.
Thank you very much, Mr. Deputy Speaker. I would agree it is indeed critical that everyone recognises the importance of our own personal actions in controlling COVID. But we also need an efficient test, trace and isolate system. And the first step of that is to actually get access to a test. With UK cases trebling over the last fortnight, demand has increased, and there have been many reports of people being sent hundreds of miles to get a COVID test. One of the most extreme included someone in Plymouth being sent by the booking system to the test centre in Inverness. I understand that demand varies depending on local incidents, but surely it's dangerous to have possibly infectious people travelling long distances when they're unwell and may need to use motor services facilities on the way. So would it not make more sense to still allow COVID tests to be taken locally and just shift the samples around the UK to the labs with greatest capacity? While the commercial Pillar 2 testing has increased dramatically since April, the laboratories are very centralised. NHS hospital laboratories are far more numerous and based within easier reach of communities. So to meet the high demand that's likely this coming winter, will the Secretary of State consider additional funding to the NHS to allow expansion of their PCR facilities and maximise Pillar 1 testing capacity?
Secretary of State.
The answer, Mr. Deputy Speaker, is absolutely yes to that last question. She's quite right that expanding the NHS capacity as well as expanding the so-called Pillar 2 capacity is right. And I think we sometimes have robust exchanges, the spokesperson for the SNP and I, but on this she's completely right. It's an and together strategy of having the Pillar 2 mass testing across the board and expansion of NHS capacity. And I'm working as closely as I possibly can with Jean Freeman, my opposite number in the SNP government in Edinburgh, to deliver that as effectively as possible right across the UK.
So Edward Lee.
Please don't take this as unduly critical, because none of us could have done any better. But the problem for the Secretary of State... Well, it's easy to be wise after the event. The problem for the Secretary of State is, given the contradictory nature of advice given to people, may be necessitated by events, is that fewer and fewer people are listening to the Secretary of State, particularly young people. And I think we need a different approach. The approach of the nanny state of ordering people about, particularly in this country, is not going to work. You've got to appeal to the good sense of young people. Stay away from grandpa and grandma. It's your responsibility. You know, these lockdowns and things are not going to work. It's your responsibility. And for us granddads, stay away from your grandchildren. Because the problem is that if you order people more and more about, they stop listening. And they realise the Secretary of State can't enforce anything. He will become the emperor without clothes. And we will go backwards. So we need an approach based on traditional self-reliance and trust the people.
Well, I understand the argument that my right honourable friend is making. Unfortunately, we have seen this play out in other countries around the world. And we've seen a sharp rise in the number of cases in the first instance among younger people. And we've seen people make the argument, entirely understandable, because that younger people are much less likely to have to die of this disease. Now, notwithstanding the point about long COVID and the fact that young people can have debilitating long-term consequences from this disease, the problem is that the isolation of older people who are more likely because of their age to have very serious consequences, it has simply not been effective anywhere in the world. And the challenge is that younger people may pass it on, for instance, to their parents, who in turn can pass it on to theirs. This disease is absolutely insidious at getting into getting through from person to person. In its natural state, this disease spreads on average from one person to between 2 and 3 others, and it doubles in the community every 3 to 4 days. And the challenge is that without widespread social distancing, as opposed to the segregation that's proposed by my right honourable friend, all the evidence is that you end up with more hospitalisations and more deaths. And I would rather get ahead of this here, learning the lessons from what we've seen first in America, then in Spain, and now sadly starting to happen in France. And I absolutely take the point about the need to communicate more, but I believe with my whole heart that we need to communicate that we all have a responsibility, including young people, and we can't let this rip through any part of the population because it will inevitably then get into all.
Video link. Dame Diana Johnson.
Thank you, Mr Deputy Speaker. Today in Hull, prospects of getting a timely local COVID-19 test are patchy. People are being sent as far away as Leeds and Withensea. So how can it be right that local councils like Hull, with statutory public health responsibilities, are being kept completely out of the loop in sorting out local testing problems in a system which seems all about protecting Deloitte, G4S and the noble Baroness Harding, rather than having that joined up national and local system that safeguards public health during this pandemic?
I'll do everything that I can to solve the problems and the challenge of having more demand than supply in capacity for testing everywhere in the country, including in Hull. But I'm afraid that trying to split off and split according to their employer the different people who are working on this, whether that's in local authorities, in the local NHS, in Public Health England, or in the private sector parts of this delivery, is just not going to help. In fact, it will make the problem worse. It was a pity to hear it from the Honourable Gentleman, the Shadow Secretary of State, because he's so often a very sensible person. And what we've got to do instead is all work together to solve these operational problems.
Anthony Mangnall.
Thank you, Mr Speaker. I congratulate the Secretary of State for the positive elements of his statement, but he will know all too well that rural communities have lived in fear over the last few months, especially during lockdown. He and the Chancellor have made a great deal of money accessible and available through the budget. Can he provide further funding for our rural healthcare network as we enter winter, not only to ramp up testing, but also to deal with those cases that have not been diagnosed and operations not undertaken?
My honourable friend makes a very important point, that especially in parts of the world like the southwest, we have got to make sure that we get the treatment out to, and we get the recovery of the NHS from COVID so that people who've been waiting for operations that might have been delayed and might necessarily have been delayed because of the pandemic, that we can get that going again. We have a goal. The NHS has set a goal of getting back to 95% of these elective operations, including the fund, and they put with it the funding to make that happen. And we've got to make that happen, especially in rural communities and right across the country.
Clive Betts.
Thank you, Mr Deputy Speaker. The Secretary of State says we all need to work together, and I'm sure he will agree we need to make better use of the excellence of public health officials at local level. Now, the Director of Public Health in Sheffield, Greg Fell, has said to me there are two obstacles to doing that. One, of course, is the need for more resources from the centre to enable local level activity to take place. But secondly, he says that local authorities like Sheffield haven't got full access to the data under the CTAS system. Currently, they only have access to the case management element of the system and not to the contact management element. And that second element is only made available to authorities on the watch list. Will he now remove that obstacle and make sure that all authorities who really want to engage fully in this are enabled to do so?
The honourable gentleman makes an important technical point that I'll take away and look at.
Stephen Hammond.
Thank you, Mr Deputy Speaker. Can I say to my right honourable friend, I really welcome the announcement about the increase in testing capacity, the comprehensive flu vaccination programme, and of course the early access to coronavirus vaccines. But you will have heard, obviously, there are some problems about access and availability. Can he set out what plans he has to overcome those operational difficulties so that it is available to people both at local centres?
Yes. In the short term, we've seen a rise in demand for testing, and the capacity, the supply, has been increasing too. We had some short-term problems with contracts, and before the summer I came to the House and described the problem with a particular contract to do with the swabs and the cleanliness of the swabs. But the bigger challenge is to make sure that capacity stays ahead of demand. And when demand has gone up quite sharply, we need to make sure that capacity expands. There's two ways to do that. The first is more expansion on the current technology, which we're doing both within the NHS, as the SNP spokesperson correctly called for, and also using more private sector capacity, the combination of the two. The second, though, where we can really break through this is with the new generation of tests, which are much easier and much better value for money and easier for people to use. And so the combination of trying to drive up capacity in the existing system, as we have been doing for months and months, and then bring on stream these innovative new tests, it's the combination of the two that we're trying to pull off.
Your call lists have got the party of Mr Smith wrong. He is from the SNP. Alan Smith.
Thank you, Mr Deputy Speaker. Like many people in Scotland, I'm a former Labour supporter and I switched to the SNP some time ago. If I was in England, I would be, but I'm in Scotland, so I'm SNP. Mr Speaker, I've much sympathy for the Secretary of State, who's doing a difficult job at a difficult time, and if he's promoting a precautionary approach, he'll allies on these benches. So, that said, would he agree with me that the exhortations from the Prime Minister to get people back into crowded transport systems, crowded city centres and congested offices is irresponsible at this time and undermines his public health messaging?
It is incredibly important. It is incredibly important that people have the confidence to know that when workplaces are COVID secure, then it's safe to go to them. And trying to get through this pandemic, protecting as much as is possible the education of our young people and the livelihoods of people in work, whilst keeping the virus under control, is a difficult and challenging balance, but it is the right balance to be attempting to strike. And he might note that both the actions of the Scottish Government and the actions that we're taking locally, for instance today in Bolton, they do have economic consequences, and I regret that, but they are targeted as much as possible on reducing the social activity, which is where we're increasingly seeing the transmission.
James Cartledge.
Thank you, Mr Deputy Speaker. We've heard from Prostate Cancer UK today of
further evidence of how the original national lockdown impacted detrimentally on cancer referrals and other aspects of cancer care. I entirely accept that was unavoidable because of the necessity of protecting the NHS through the peak of the pandemic in the spring. But as we move to a new phase of local rather than national lockdowns, hopefully, can he assure me the NHS will do everything possible to ensure that rising numbers do not again translate into a negative impact on those with other conditions that can, after all, also be fatal?
Yes, absolutely. And my honourable friend makes an incredibly important point with which I agree wholeheartedly. The backlog that was caused by the inevitable and unavoidable, as he put it, delays to treatment in the peak, that has more or less halved, which is good news, so there's progress. And we've put in place, we've changed the NHS to essentially be split between sites that are COVID secure and sites where there may be COVID, and that will help us to protect cancer treatment as we go forward, exactly as he asked for.
Manira Wilson.
Thank you, Mr Deputy Speaker. On the 16th of July, I flagged with the Secretary of State that the Academy of Medical Sciences was warning we needed a rapid expansion of test and trace to be prepared for a second wave. He told me they were learning lessons as we go. Today, pupils and parents in my constituency are being sent as far as field as Aberdeen and Newquay for tests. They can't get home tests. Children are back at school. Forget world beating. What is he doing to ensure we have a functioning test and trace system in place right now?
Thank you, Mr Deputy Speaker. We have the largest testing system imaginable. We want to expand it further. And of course there are challenges, as many members have raised, but the imperative for people who have symptoms to get a test is important, and we're trying to solve the operational problems that she talks about.
Stevenson.
Mr Deputy Speaker, I was saddened yesterday to hear that because of a rise in local cases, care home visits in Wolverhampton are to be severely restricted again. I have a dear friend, Felicity, who lives in a care home without regular visits from family and loved ones. Her mental health and well-being has declined very noticeably over the past months. I absolutely recognise the heroic efforts of care home staff, but how can we facilitate safe family visits so that care home residents can enjoy quality of life?
Well, Mr Deputy Speaker, my honourable friend asks an incredibly important question with great sensitivity, and the decisions over the visitor arrangements for care homes are rightly made by the care home in consultation with a local Director of Public Health according to the local risk. And I do want, of course, to see as much visiting as possible and to see it done safely. This is the difficult balance that needs to be struck, not least because of the negative health impacts, both mental and, frankly, physical, of the restriction of visiting to care homes. And I also very much hope that as testing expands, we'll be able to use that more and more to provide for safe visiting.
Nick Smith.
Mr Deputy Speaker, looking to the long term, obesity is a leading risk factor for contracting COVID-19, and problems with obesity usually start in childhood. Now, by this year, the government was aiming to reduce sugar by 20% in the food products most popular with children. But Public Health England's 2019 review on this showed a sugar reduction of just 2.9%. So the government's clearly way off track. Why hasn't this 20% ambition been met?
Well, I entirely agree with the premise of the question, which is that tackling obesity is critical for the long-term health of people, and that has been highlighted yet further because of the impact of obesity on the likelihood of you dying from COVID if you get it. Of course, I want to see that sugar reduction. The sugar tax has had a very significant impact on the areas that it covers, and we've got a wider obesity strategy that the Prime Minister set out in July to drive forward this agenda.
In Russell.
Thank you, Mr Deputy Speaker. Across Watford and across the entire UK, there have been volunteers who have been going out on the front line helping our NHS, our brave NHS workers. One group I met with recently was St John Ambulance, and they were explaining to me that the red tape that would have been in place a year ago would have made it impossible for them to be able to help. And now they've been able to cut through that during the COVID crisis. Can you please assure, can my right honourable friend please assure me that as we move forward, that red tape won't start binding their hands again so they can continue to help?
Yes, absolutely. My honourable friend is quite right. There are improvements that we made in the heat of this crisis that we should never go back on. He's just highlighted one example. There are a legion others, and in this House sometimes of course we discuss the problems that need to be fixed, and that's quite right, and often they're raised and I didn't know about them in advance and I'll go out and fix them. That's my job, as the honourable gentleman opposite raised in this example. But we should also note where things have gone well because of changes and be clear that we won't be going back on that.
Laura Sultana.
Mr Deputy Speaker, this month more than 1 million students are moving to university for the new academic year, and I welcome the thousands who will be joining Coventry University and the University of Warwick, both in my constituency. Both Sage and Independent Sage have warned that the government needs to get a grip and work to minimise the risk of this leading to more COVID-19 spreading. So will the Secretary of State work with his colleagues to support universities, heed the recommendations of scientists, the University and College Union, the National Union of Students, including the recommendation to move to remote learning as default?
Well, we're working, Mr Deputy Speaker, very closely with the university sector, including the 2 universities that she mentions, to make sure that we can get the universities open and get that done in a COVID-secure way.
There will be more.
Thank you, Mr Deputy Speaker. From today, indoor gyms and dance studios are now able to open in Keighley. So can I thank my right honourable friend for this move, as I know it comes as a welcome to many. I have, however, been contacted by many shop owners who, unfortunately, are being verbally abused when reminding customers to wear face coverings. Will my right honourable friend join me in calling for all to adhere to the basic rules of washing hands, wearing face coverings and social distancing?
Yes, and people will be hearing far, far more about this. Hands, face, space. It's really simple. Wash your hands, wear a face covering when you need to, and keep that social distance. That is the responsibility of everybody to help us control this virus.
Video link.
Mr Deputy Speaker, the Secretary of State has had 4 months to respond to a letter I sent as the chair of the APPG on cancer, requesting a national cancer recovery plan. Of course, I recognise the extreme strain of COVID-19 put on the NHS and his department, but people living with cancer, diagnosed and yet to be diagnosed, have been left in limbo. Mr Deputy Speaker, when will the Secretary of State respond to my letter, and when will he make public his government's National Cancer Recovery Plan?
Mr Deputy Speaker, I'll respond right away. I'm very glad that she's raised this issue. It's something that I've been doing a huge amount of work on, along with the Minister and the member for Bury St Edmunds, and we've been working on it intensively. And as I say, the backlog has come down by about half, but clearly there's much more to do.
Randall.
Mr Deputy Speaker, testing is a vital line of defence against coronavirus, and while we've got one of the best testing systems in the world, I appreciate there's much more that can be done. Can my right honourable friend tell me what steps he's taken to explore the benefits of repeat population testing, and if that's effective, would he look to scale that up across the country?
We are looking at the asymptomatic testing of parts of the population where there is where the virus is rife. Testing rollout is about the prioritisation of what you can do with a capacity that we want to grow. So as the capacity grows, we can do more, but also you have to prioritise within that capacity. Getting to a point where everybody tests, say, weekly or more regularly than that, is not an impossible thing to envisage, but there are many, many steps along the way.
Smith.
That young people will be, and with the universities returning shortly, there'll be lots of students moving into shared houses. So there's real concern in communities like mine in South Manchester, where there are lots of HMOs. Now, there's clearly lots of good work going on to make campuses COVID secure, but the recently published SAGE advice is very thin on community spreads around universities. So will he urgently provide that national plan for managing that situation, limiting transmission in communities around where students live, and including, I think, comprehensive testing at universities?
We are doing a huge amount of work on exactly the issue that he raises. Ultimately, when students are off campus, then they're citizens like everybody else. And so, hence the focus on the social distancing rules that we all have to follow. But he's right that we've seen the biggest rise in the 17 to 21-year-olds who are the same people many of whom are going to be going to university in the next few weeks.
Thank you, Mr. Deputy Speaker. Firstly, I'd like to thank the Secretary of State and his team for their tireless work throughout this pandemic. Last week, I had the pleasure of visiting the Coomber Centre in West Bromwich, where I met with Patricia and her team to hear about their passion for helping the local BAME community get through this difficult time, including the mental health support they provide to the local area and some junior doctors. What further support can he make available to similar organisations who are supporting the community and our heroes on the front line of the NHS?
Well, this is again an important question for how we can get the support locally, especially into the West Midlands, where it's so important, especially with cases rising, that we not only have a national response that we discuss in this chamber, but we make sure that the local community, who my honourable friend supports so effectively, can get the support they need. I'm very happy to write to her with details of the extra funding that we've put into her area and discuss with her what more might be done.
Lee Lynch.
Thank you very much, Mr. Deputy Speaker. Whilst I appreciate that we've got to be keeping a very close eye on those infection rates and responding quickly and effectively, the government says that it's listening to local leaders on the local restrictions, yet the very clear data-led recommendation from myself and Calderdale's leaders last week was for the restrictions to be lifted in Halifax with a continued focus on test and trace and the incredibly effective targeted community work which is being undertaken by Calderdale Council. Now that Calderdale has significantly lower infection rates than areas that do not have the restrictions, can the Secretary of State tell me when Halifax will see those restrictions lifted and what else he would need to see happen to make that reality?
Well, we look at the question of the restrictions in Halifax every week. Calderdale has seen a fall in the number of cases. It's an example of a local lockdown being effective. I was really pleased we were able to take some parts of the local authority area out of the restrictions 10 days or so ago now. And it was very good to be able to make that progress. I accept that we had to leave Halifax in the restrictions, and I look forward to working with the council, with her and with and other local colleagues, and we'll be considering it again this Thursday.
Greg Smith.
Thank you, Mr. Deputy Speaker. The scaling of testing has been an incredible achievement over the summer. And I heard from many constituents able to get same-day tests with results in as quick as 12 hours. But I have to say, in recent days, I have had a number of cases of constituents unable to get timely testing or being asked to travel an unacceptable distance. So in welcoming my right honourable friend's commitment to further scaling testing capacity, especially by embracing new technology, what assurances can he give Buckinghamshire residents that that will be a rapid scaling and that they will be able to get local and quick tests?
Well, my honourable friend's exactly right. We're going as fast as we possibly can, and I recognise the importance of this. There was spare capacity earlier in the summer, and hence the turnaround times. The turnaround times we've maintained very rapidly. But there have been challenges in the last couple of weeks because of that increase in demand and some of those operational issues that we've discussed. He's quite right to raise this. He's raised it with me privately before. There is no one more assiduous in putting forward the needs of his constituents than my honourable friend, and I'll keep him posted on how much we can expand testing further in Buckinghamshire.
Chris Stevens.
Thank you, Mr. Deputy Speaker. On a similar point raised by the Shadow Front Bench, can you tell us what advice and guidance his department is issuing to employers who are trying to use COVID-related absence to trigger points for absence management interviews and trigger points to remove occupational sick pay as we've seen recently with attempts carried out by IKEA, who then dismissed the trade union representative who had the temerity to tell trade union members what the employer was up to. So can the Secretary of State tell us what advice and guidance he's given and really condemn those employers who are trying to treat COVID-related absences to remove occupational sick pay and the like? Thank you.
Well, the honourable gentleman raises a point that is that I know that the Bayes Secretary of State is looking at. Of course, returning to a COVID-secure setting is safe and is the right thing to do if that's and that's a matter between the employer and the employee. But people must follow employment law, and that, after all, as an employer, is the statutory duty.
Miriam Cates.
Thank you, Mr Deputy Speaker. We've seen incredible advances by the UK scientific community throughout the pandemic, and it's great news that scientists from the University of Sheffield are joining the UK Coronavirus Immunology Consortium to undertake research that we all hope will lead to an effective vaccine. But until we have that vaccine, we've got to take seriously the threat of a rapid rise of the virus again. So does my right honourable friend agree that with cases on the rise, we mustn't hesitate to use local lockdown measures like the ones he's mentioned in Bolton, to make sure that increased infection rates in the young does not lead to increased hospitalisations in the older population?
That is absolutely spot on, and the logic the logic that we've seen repeated in country after country, that a sharp rise amongst younger people then leads inexorably to a rise in the number of hospitalisations and deaths, even though it's not the younger people who tend to get hospitalised, but others who catch it from them. It's really important that we get that argument across so that everybody feels the necessity to follow the social distancing rules that are incumbent on us all.
Hilary Benn.
Thank you very much indeed, Mr Deputy Speaker. I think the Secretary of State has got the message about the need to sort out the testing problem, not least to help councils like Leeds that are working really hard to try and limit the increase in cases. And I hope he would join me in paying tribute to the public health team and to the council for the great efforts that they are making. On contact tracing, he knows that local contact tracing is the most effective. I understand the figures in Leeds, it's high 90s in terms of contact when it's done locally, as opposed to a lower figure done by the national system. So I'd like to ask him, can he commit, given the position in Leeds, to providing more support and resource to local contact tracing in the city to help try and prevent a further increase in the number of cases?
Well, absolutely, we're putting more resources into that local end of the contact tracing, but it is one system, and I just stress to him that fact. I think he's slightly made the same category error that the honourable gentleman on the front bench opposite made, in that if you count contact tracing results from institutional settings within the local categorisation, then of course the number of contacts that you reach is higher, because it's so much. For instance, in a care home, it's very easy to reach 100% of contacts by the nature of the setting. So it's very important. This was unfortunately the honourable gentleman opposite on the front bench, who's also a very sensible fellow, tried to make this comparison, and it isn't quite fair to compare. He's not quite comparing apples with apples.
Well, Mr Deputy Speaker, the Secretary of State is right, I think, to warn against complacency. And I think perhaps if we were to be careful to urge people, to remind people we're in this for the long haul, I think that would be wise. Can I just ask him a question about testing? The Director of Testing for NHS Test and Trace has confirmed that we have testing capacity at all of our testing sites, and that there's a critical pinch point in the laboratories. My Director of Public Health, who's excellent, and I know a number of her colleagues in the South West, would prefer that rather than artificially limiting access to testing sites and home testing kits, we ensure people could take those tests locally and manage the pinch point at the laboratory end of things, because that would improve public confidence in getting testing. Is that something that he could take away and look at? And if we can't do that, can he at least give me a good reason that I can take back to her about why that's not possible?
The good reason is that if I entirely understand the point, and I can see the argument that's being made. The challenge is that Since lab capacity is what we need more of, if you take more swabs locally and then send them in to the lab, you've got to have the lab capacity to be able to turn them round. So otherwise you get much slower response, and the slower response means that you're not getting back to people fast enough for them to be able to act. So that's the nature of the challenge, and the answer to it is more lab capacity, which is what we're driving through.
Angela Eagle.
Thank you, Mr Deputy Speaker. In Wirral, there's been a sudden sharp rise in COVID-19 infections, with yesterday's figures standing at 33 infections per 100,000. What extra assistance can the Secretary of State promise my local authority, which is fighting very hard to suppress this outbreak? And on test and trace, if he doesn't want reorganisations of test and trace because he thinks it will slow progress, can he tell us why he's reorganising Public Health England in the middle of this dangerous pandemic?
Well, of course, I'm improving the way that the public health response is by bringing together different organisations. I'm not sure she's doing anything other than. I'm not going to query her motives because we've worked together at the start of this crisis, especially. On the question on the Wirral, absolutely we're vigilant and looking at the Wirral. That'll be considered in the JBC Silver meeting tomorrow and JBC Gold on Thursday. And the part of the improved data that we have now compared to a few months ago means that we will be able to pinpoint where the problem is and, working with the council, make recommendations on what action needs to be taken.
Dr. Julian Lewis.
Can my right honourable friend explain to the House exactly which are the main factors that give us a reason for the fact that although the level of infection often continues to rise, the numbers of deaths is now so absolutely small?
Well, my right honourable friend asks an important point, and the answer is, firstly, that of course there is a lag between people catching the disease and the statistics for new cases and those who sadly die. And the second is that this rise most recently has been largely, predominantly, not entirely, amongst younger people who are much less likely to die. But the danger is not. The danger is that they will pass it on to others and it will spread more broadly into the community. So it is important to act on these cases, even though thankfully, currently, the number who are dying is small. You could put it this way, if I try to give a better answer. You put it this way. If we were to wait until we saw the number of deaths rising before we took action, then there would already be many, many people who had caught the disease, who would end up hospitalised, who would, unfortunately, die of coronavirus. You have to act before that happens and before this disease spreads to those who may die from it, because the alternative is that we will see the number of deaths rise inevitably. And
Peter Dunn.
Thank you, Mr Deputy Speaker. Given COVID, the Health Secretary has said it was mission critical to prepare the NHS for the winter as he unveiled the biggest flu vaccination programme in history, which is very Trumpian, I have to say. In the light of the lockdown delay, the PPE debacle, testing and tracing chaos, we couldn't get tested in my borough yesterday with 300,000 people in it, not to mention, I'll remind the Secretary of State, the 40,000 people already dead from COVID on his watch, and that of the Prime Minister, and he's quite happy to compare it internationally, 9,400 in Germany. Why should we have any confidence in this bungling government's ability to get the flu vaccination programme in shape for this winter?
We're going to have the biggest flu vaccination programme in history, and I think the gentleman opposite simply hasn't taken into account of the action that was taken to protect the NHS in the crisis, building a capacity for testing that is bigger per head of population than any other major European country, that this country is the only country in the world that has discovered treatments that reduce your likelihood of dying from coronavirus. I think he should get on side with what this country is doing, not keep squibbling from the sidelines.
Hello, back.
Your watch.
Thank you very much, Mr Deputy Speaker. The Government and the Secretary of State have messed up. The result has been loss of life and an economy in tatters. It is little wonder that my home, South Shields, is now seeing a rapid spike in cases, and we are approaching a potential lockdown that will irrevocably devastate us. Instead of just pointing the finger at our young people, will he take some responsibility and explain what extra direct support he's going to give us locally to help us stop this spread?
Mr Deputy Speaker, I regret the tone of the question. I think it is far, far better for everybody if we all work together. I know she and the previous member who spoke seem to have taken an attitude which is it's better to have brickbats thrown across this house. I think the public would expect us to work together for the benefit of South Shields, to work together for the benefit of the North West. I'm very happy to meet her and discuss the situation in South Shields and see what we can do to try to tackle the problem, and it's better to do that together.
Jerome Mayhew.
Mr Deputy Speaker, my right honourable friend has identified that our response to COVID is about personal responsibility. It's made much harder when you have the young with the lure of socialising and the risks substantially borne by unseen others. By my view, the young are just as civic-minded as all the rest of us, but it's a complex message. So what is the communication strategy to get that message effectively over to our young people, particularly when the access to Parliament TV seems unaccountably low?
It is so important that we explain to everybody that they have a responsibility to hands, face and space, to their social distancing. And the two critical messages for younger people who may think that this isn't a disease that affects them is firstly, they can transmit this disease and cause great harm or death to their loved ones. But secondly, that nobody is immune from this disease, and the long-term impact of COVID, so far that we've seen on 60,000 people who've suffered for more than 3 months, that long-term impact can be devastating, and that can happen to anyone.
David Linden.
Thank you very much, Mr Deputy Speaker. The credit checking company TransUnion have had difficulty issuing home testing kits to people because they're not in the public electoral register. Now, we know that for good reason some people are not in the public electoral register, perhaps due to fleeing domestic violence or abuse. Can I ask the Secretary of State if you'll go away and have a look at this and see what you can do to make sure that everybody can get a home test regardless of whether they're not on the public electoral register?
I'm very happy to look at this point. Of course, we do have to verify the identity of people who are asking for home testing kits, and there has to be protections against fraud, and we take advice from the National Cyber Security Centre on that, but I'll look at the point that he raises.
Marie Miller.
Thank you, Mr Deputy Speaker, and can I commend my right honourable friend on the swift action that he takes and the way in which he comes before this House on a regular basis to update us. I think that is important. And the lessons that are being learnt from other countries. In his statement, he actually announced something as well as the lockdown in Bolton, is that his current guidance regarding people in high incidence areas socialising only with those in their own households will be turned into law. That's presumably to strengthen enforcement. Could he perhaps take a moment to explain what that will mean in practice, and will there be an impact on venues who might be required to be part of that enforcement process, and when does he intend to bring that before the House for discussion?
That measure is specifically in Bolton, where Bolton had brought into place at a council level the guidance that people shouldn't socialise outside their household, and we'll be turning that into law in Bolton. Of course, we keep all these sorts of things under review nationally, but just to be absolutely clear, the measure that I announced today was specifically with respect to Bolton. And can I also thank my right honourable friend for her kind words? I do my best.
Thank you very much. Mr Deputy Speaker, we still haven't fully gotten over the Dominic Cummings cross-country drive farcical fiasco, and yet day after day we are faced with a string of embarrassing government U-turns which not only demonstrates incompetence but it further erodes public trust and confidence in the government at a time when we most need it in order to overcome this virus. So, in order to get on message, what discussions is the Secretary of State for Health having with the Prime Minister to ensure that the next time he makes a public statement that will not be followed up by yet another excruciating and embarrassing U-turn.
Mr Deputy Speaker, the honourable gentleman does better when he doesn't take the Labour Party handout notes.
Thank you very much, Mr Deputy Speaker. Can I pay personal tribute to my right honourable friend? Berry has been in restrictions for 6 weeks, and both he and his team have been a constant source of support, not only to myself, the leader of the council, but also to the people of Berry through this difficult time. I agree with everything that he said, but I would welcome his views on this point. One of the challenges that is being faced within my constituency is childcare. And many grandparents look after children. We're having a situation where many people are looking to get back into work. Many grandparents are struggling because they remain in the bubble that we have in Bury. It is one person to another household. Many grandparents are still living together. They are asking the Secretary of State, can that bubble be extended to 2 people per household to allow those grandparents to provide the emotional, practical and social support to their family at this very difficult time?
I do understand why grandparents in Bury and across the country want to see this happen. The challenge is that the support bubbles are there primarily so that when people are living on their own, they can get that emotional and mental health support from having some people who they can closely communicate with. Whereas, of course, a couple living together have each other for that. The challenge in terms of childcare is that whilst children are very, very rarely have any negative impacts of COVID themselves, they can transmit the disease, and grandparents are at risk if they're typically over about 70. And so we are quite cautious about encouraging grandparents to look after their grandchildren because of the problem of transmission. So that's the challenge that we're trying to address, but I do understand why people want to see this.
Barry Gardner.
On the 3rd of July, the Secretary of State said that asymptomatic testing in residential care homes would give staff the confidence to continue with their work. Yesterday, the Transport Secretary said that Public Health England now believed that asymptomatic testing might only capture 7% of those who were infected, leaving 93% of those infected to go about their business. If asymptomatic testing is as confidence-building as the Secretary of State says, and if a care home is a goose and an airport is a gander, why is the source of asymptomatic testing not good for both of them?
The question is about the timing of the test. So the proposal for care homes is for repeat asymptomatic testing. As I said in my statement, we got test kits out to the eligible care homes. The challenge for asymptomatic testing at the border is that if you just do it once, that doesn't give confidence. So the proposal with which we're working with the industry is a way to do that with repeat testing. To test that later, people haven't developed symptoms that they might have been incubating previously.
Wycliffe.
Thank you, Mr Deputy Speaker. In recent weeks, my constituency of Hamburn-Hassenden was removed from local restrictions, and I'd like to put on record my heartfelt thanks to all of my community. That is why we have now fallen in line with the national picture, and I'd also like to thank everybody in the department and the Secretary of State for being so responsive throughout. But can the Secretary of State please press that local resilience forums and local outbreak management boards set out and publish the criteria used to make their decisions for areas moving to higher or lower levels of restrictions, so that the decision making is fair, consistent, transparent and justifiable to constituents?
I will absolutely take forward the proposal that my honourable friend rightly makes, and she has been an unbelievably hard-working and assiduous voice for her community in Hyndburn. We've had a lot of contact during a difficult period, and I want to join her in paying tribute to the people of Hyndburn who have followed social distancing, brought the case rate right down. It's another example of local action that has worked, but we must remain vigilant because, of course, the area of East Lancashire, close as it is to Greater Manchester, that is an area where we have seen a lot of cases, including, as I say, today in Bolton. But she has done her area proud in the way that she's represented them and made the case for them during this very difficult period.
Isabel Roberts.
From 6 p.m. today, Caerphilly will become the first area of Wales to enter a local lockdown. Does the Secretary of State agree with me that Wales urgently needs more financial powers to support people affected by these necessary precautions?
Well, Mr. Deputy Speaker, I'll speak to my opposite number in the Welsh Government about that suggestion. I know that taking local action, whether it's in Caerphilly in Wales or whether it's in and around Glasgow and Aberdeen in Scotland, or of course in parts of England, which is my responsibility when it comes to the local action, we only take this action with a heavy heart and when it is necessary.
And finally, Wayne David.
As the Secretary of State has just indicated, he is aware of the situation as it's developing in Caerphilly, in my constituency. But will he give a commitment to ensure that he works as closely as possible with the Welsh Government to ensure that they are effective in dealing with this situation?
Yes, I absolutely will. The UK Government and the Welsh Government working together is incredibly important. We have weekly calls and Vaughan Gething and I speak and are in contact regularly. I support the action that he has had to take, as I say, with a heavy heart, but it is necessary action. And my message to the people of Caerphilly, who are so ably represented in this House, is that this action and following the local rules, the stricter local rules, is absolutely critical to getting this virus under control locally and to protecting people themselves and protecting their loved ones.
I'd like to thank the Secretary of State for his statement today. Thank you. Before I take the point of order from Maria Miller, those leaving the chamber, please do so with care and socially distanced. Point of order, Maria Miller.
Thank you, Mr Deputy Speaker. And in Foreign Office questions today, a number of members raised the plight of the people of Belarus. And indeed, yesterday we saw the remaining opposition leader, Maria Kolesnikova,